Now reporting, Tom Yamas.
And good afternoon. We come on the air because President Trump is about to speak on the coronavirus outbreak. The White House calling the news conference as health officials in Washington state confirm a patient has died from the infection. State health officials say this is in the Seattle area, the first coronavirus death reported so far in the U.S. And after that, the Dow lost nearly 4,000 points last week amid mounting coronavirus concerns. Again, the president about to speak. We're moments away from taking this news conference as it begins. Dr. Jen Ashton is with us by phone right now. And Dr. Jen, what is the health community, the medical community around the country, what do they want to hear from the president right now?
Well, I think what we always want to hear in a medical emergency is a sense of calm and a clear explanation of what's known and what's not known. A lot of times in medicine, it's just as important to say and know what we don't know than what we do know. And I think that this is a perfect example of that. I think that there should also be some kind of acknowledgement of how frightening this is to the general population and what steps are being taken to ameliorate that.
But again, Jen, and you've stressed this throughout all of your coverage on ABC, now is the time to prepare, not panic. The president has entered the room. Let's listen in.
Good afternoon, Mr. President.
Thank you very much, everybody. Before we begin, I'd like to congratulate all of those incredible people that have worked for so long on our endless war in Afghanistan, 19 years, going on 20 years, and there hasn't been a moment like this. We've had very successful negotiations. We think they'll be successful in the end. The other side's tired of war. Everybody's tired of war. That's been a particularly long and gruesome one. And I want to congratulate President Ghani and the people of Afghanistan. I want to remember all of the people, all of the great, great men and women that have lost their lives in the war, and to their parents and wives and husbands and families, brothers and sisters. It's a great, great people. Many lives over such a long period of time have been lost. I want to thank our wounded warriors, people that are still bearing pain and all of the problems that they've had to go through. And they're incredible people, incredible spirit. I'd go to Walter Reed and see them so often, and the spirit they had, they wanted to go back. Despite their wounds, they always said, I want to go back. Wounded warriors, they're incredible people. I guess most of all, I want to thank all of the people in the United States for having spent so much in terms of blood, in terms of treasure and treasury, the money that has been spent, the lives that have been lost. And we just signed an agreement that puts us in a position to get it done, bring us down to in the vicinity of 8,000 troops. The United Nations was informed of everything, and NATO has been great. Secretary Stoltenberg has been fantastic. And I want to thank the United Nations for the help they gave, and I also want to thank and congratulate Secretary Stoltenberg of NATO. 29 countries involved, and all approving, all very happy with what's going on. I want to also thank and congratulate Secretary of State Pompeo and Secretary of Defense Mark Esper. And I'll be meeting personally with Taliban leaders in the not-too-distant future. And we'll be very much hoping that they will be doing what they say they're going to be doing. They will be killing terrorists. They will be killing some very bad people. They will keep that fight going. We've had tremendous success in Afghanistan in the killing of terrorists, but it's time, after all these years, to go and to bring our people back home. We want to bring our people back home. And again, it's been a long journey in Afghanistan in particular. It's been a very long journey. It's been a hard journey for everybody. We're very largely a law enforcement group, and that's not what our soldiers are all about. They're fighters. They're the greatest fighters in the world. As you know, we've destroyed in Syria and Iraq 100% of the ISIS caliphate, 100%. We have thousands of prisoners. We've killed ISIS fighters by the thousands. And likewise in Afghanistan, but now it's time for somebody else to do that work, and that'll be the Taliban. And it could be surrounding countries. There are many countries that surround Afghanistan that can help. We're 8,000 miles away. So we'll be bringing it down to 8,000 to approximately 8,600 in that vicinity. And then we'll make our final decision some point in the fairly near future. But this was a very spirited agreement. There was a lot of talk. There was a lot of everything. They've been trying to get this for many years, and just it's time. So I just want to thank everybody. I want to congratulate everybody. I really believe the Taliban wants to do something to show that we're not all wasting time. If bad things happen, we'll go back. I let the people know we'll go back, and we'll go back so fast, and we'll go back with a force like nobody's ever seen. And I don't think that will be necessary. I hope it's not necessary. And so I just wanted to bring that up before we begin on a topic that has become very, very important to everybody. First of all, the amount of work that these professionals behind me and many other professionals in many rooms behind us who are watching right now, I don't have the room here to bring them all in, but they have been working round the clock so hard on the coronavirus. It's a tough one, but a lot of progress has been made. I want to provide an update to our people, to our citizens, to the world, frankly, on our action to address the coronavirus and those that have been hurt badly by it. At this moment, we have 22 patients in the United States currently that have coronavirus. Unfortunately, one person passed away overnight. She was a wonderful woman, a medically high-risk patient in her late 50s. 4 others are very ill. Thankfully, 15 are either recovered fully or they're well on their way to recovery. And in all cases, they've been let go and they're home. Additional cases in the United States are likely, but healthy individuals should be able to fully recover. And we think that will be a statement that we can make with great surety now that we've gotten familiar with this problem. They should be able to recover should they contract the virus. So healthy people, if you're healthy, you will probably go through a process and you'll be fine. Since the early stages of the foreign outbreak, my administration has taken the most aggressive action in modern history to confront the spread of this disease. We moved very early. That was one of the decisions we made that really turned out to be a lifesaver in a sense, big lifesaver. On January 31st, I imposed travel restrictions on foreign nations who had, and anybody that had been to China or people coming out of China. And I want to say that China seems to be making tremendous progress. Their numbers are way down. And if you read, Tim Cook of Apple said that they're now in full operation again in China. the numbers are way down. Experts now agree that the decision to move so quickly, despite a lot of opposition on that decision, was a wise one. It greatly slowed the spread of the virus to the United States, and it really gave us time to do some of the critical moves that we've done. And it allowed these great professionals to get together and figure it all out. And we think they've done that. We've taken the most aggressive actions to confront the coronavirus. They are the most aggressive taken by any country. And we're the #1 travel destination anywhere in the world, yet we have far fewer cases of the disease than even countries with much less travel or a much smaller population. As an important part of our efforts, on Monday I'll be meeting with the largest pharmaceutical companies in the world, actually. They'll be coming to the White House, and we're talking about a vaccine and developing very quickly, and they've already started working on it, developing very rapidly a vaccine for the virus, to combat the virus. And we're having very good initial feedback. But these companies will be coming to the White House on Monday. Tremendous amounts of supplies are already on hand. We have 43 million masks, which is far more than anyone would have assumed we could have had so quickly. And a lot more are coming. Today, the White House Coronavirus Task Force, led by Vice President Mike Pence, they met for 2.5 hours. I spent a lot of that time with them also, and we came up with some ideas, recommendations, and frankly, some pretty strict edicts that we're going to be going by, and Mike's going to be discussing that. But we are really having a group of people that is so talented, and they're working round the clock. And for that reason, I really would wish that we could report exactly what's happened, how well we're doing under quite adverse circumstances. But we're doing really well, very, very professionally handled. Our country is prepared for any circumstance. We hope it's not going to be a major circumstance. It'll be a smaller circumstance. But whatever the circumstances, we're prepared. And I'd like to just ask and caution that the media, we would respectfully ask the media and politicians and everybody else involved not do anything to incite a panic, because there's no reason to panic at all. This is something that is being handled professionally. I also want to thank, by the way, governors and representatives of our various states, in some cases, some more than others, because they've really been working very hard in areas where we've seen indication of the virus. But I want to thank the governors and all of the representatives from all of our states, the rooms they've made available, the speed with which they've worked has really been incredible. So, again, thank you to everybody. I'm going to ask Mike Pence now to discuss a little bit about travel. And we have some restrictions on some travel from other countries that are having a hard time. And I want to thank everybody. We'll take some questions as soon as we're finished. Thank you very much.
Thank you, Mr. President. Let me begin, as the President did, by expressing our deepest condolences to the family of the woman in Washington State who's lost her life to the coronavirus. I want to assure that family that they're on the hearts of every American and those that are continuing to struggle. In some cases, in ICU units, can be assured of the prayers of millions of Americans. From the moment that this country learned of the spread of the coronavirus, President Donald Trump took decisive action, established the White House Coronavirus Task Force. And as the President just described, the President took unprecedented action to suspend all travel into the United States from China. simply had never been done before by any previous administration. It is among the reasons why the threat to Americans of coronavirus remains low, despite today's tragic news from Washington State. The task force met this morning and brought the President a range of options, and at his direction, we will be doing the following. First, the President authorized action today to add additional travel restrictions on Iran. We will be using Section 212F, banning travel from Iran. Iran is also already under a travel ban, but we are expanding existing travel restrictions to include any foreign national who has visited Iran within the last 14 days. In addition to moving Iran, we are going to increase to the highest level of advisory, which is level 4, advising Americans do not travel to specific regions in Italy and South Korea. Let me say again, the President today has authorized the State Department to increase the travel advisory for Americans to level 4. We are urging Americans to not travel to the areas in Italy and the areas in South Korea that are most affected by the coronavirus. The President's also directed the State Department to work with our allies in Italy and in South Korea to coordinate a screening, a medical screening, in their countries of any individuals that are coming in to the United States of America, and we look forward to working with them in a collaborative and a cooperative way. Now, with regard to the task force, I'm just a few days into this job, but I can tell you, having spent time with these extraordinary professionals that the President just alluded to, having spoken directly to more than a dozen governors, including Governor Jay Inslee this morning in Washington State, I think every American would be proud to know what I've heard about the work of HHS, the work of CDC, the work of all of our agencies. At the President's direction, this team has been working seamlessly with health officials at the state and local level. And I can assure the American public that we will continue to live out the President's admonition a few days ago that we're all in this together. And as we work with members of Congress, I've had the opportunity to speak with Republican and Democrat leadership in the Congress. We'll be working very closely on a supplemental funding bill to make sure that not only do all these agencies have the resources that they require, but we'll also make sure that state and local health officials.
We've been following this news conference out of the briefing room in the White House with some breaking news. Vice President Pence, who's leading the coronavirus effort here in the United States, announcing just now they are expanding the travel ban in the United States, expanding with Iran, and then giving the highest level travel advisory, advising Americans not to travel to Italy and South Korea because the cluster of coronavirus cases in those countries right now. The President insisting the U.S., quote, is prepared. I want to bring in our chief medical correspondent, Dr. Jen Ashton, right now. Dr. Jen, you were listening with me as we heard both the President and the Vice President speak. This travel ban now going into effect. They're expanding it, and they're telling Americans basically, we don't want you to go to Italy. We don't want you to go to South Korea.
Yeah, you know, Tom, to me that sounds like there's still an attempt at containment. When you talk about an infectious disease outbreak like this, of this nature, that's global, at some point we're going to be shifting from the containment stage to what's called a mitigation phase. And that means, how is this going to interrupt our day-to-day activities here and how we can take steps to minimize that. I think the screening at the airports is obviously important. And as we heard from the World Health Organization yesterday, when they raised their alert to the highest level of concern, saying, and I quote, "This is a reality check for every government on the planet. Wake up and get ready." I think we do need to understand that now is not the time for panic, that this is the time for preparedness. So in the community right now, and it's a weekend, so this is a perfect time to start inquiring about this. You know, you should be checking with any representative from children's schools, from your workplace. And most importantly, Tom, because we are expecting more community cases, if someone has been traveling really anywhere, but certainly to these countries where there are high levels of coronavirus, and you develop a fever or you're concerned with symptoms, do not simply or immediately rush to an emergency room unless you are having emergently shortness of breath. Call the emergency room, call the provider, and call the Department of Health so they can instruct you on the best course of action.
Dr. Jen Ashton, stand by for us. We do appreciate that. And of course, there was another major headline out of the White House that the president announced saying that the U.S. has struck a deal with the Taliban in hopes of ending the longest American war in history, the war, of course, in Afghanistan. The president saying ultimately the goal would be to keep about 8,000 troops there. We will have much more on this story and the coronavirus case on World News Tonight. We're going to continue our coverage on our streaming channel, ABC News Live right now. I'm Tom Llamas in New York. We thank you for watching here on the ABC network. We're now going to return to the XFL game.
This has been a special report from ABC News.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.